Okay, you guys, welcome and thank you so much for coming. All right, for those of you who don't know me, my name is Tina Shropshire. I am the nurse practitioner for the clinic, open to you for anything that you might need, good, bad, or different. Okay, so we're going to talk about stress management today. I'm going to talk from personal experience and different things I've dealt with stress. If you have any questions, comments, concerns, just jump in and just chime in. Okay. So I think this is something that affects everybody. There's nobody who's exempt from stress, no matter what your position might be, no matter what money you might have in the bank. I think every single person encounters some form of stress sometime through life. So it all depends on how you let it affect you and what you do with it. So what exactly is stress? So stress is a feeling or emotion of being under too much mental or emotional pressure. Okay, so the pressure turns into stress when you feel like you're not able to cope with it. Stress can affect how you feel, think, behave, how your body works. In fact, common signs of stress include sleep issues, sweating, loss of appetite, and difficulty concentrating. So we use a lot of neurotransmitters and that to be able to concentrate, focus, think, get our words out. And when you're stressed, you're using even more. And you kind of can use them up. And when you need it for every day, it's like, oh, wow, that recall isn't there. You may feel anxious, irritable. You might feel like you have some low self-esteem. You might have racing thoughts, just thoughts you can't even turn off and it'll keep you up at night. You might worry constantly or go over things over and over in your head. You might notice that you lose your temper easy, might drink more or act unreasonably. Like later on you think, geez, I shouldn't have did that. I could have handled that better than that. You may also experience headaches, muscle tension, pain, and dizziness. Okay, so main causes of stress. One thing that I would like to just overstate is that some of it is self-generated. Sometimes people take on a lot of stress. That's just the type of a personality that they are. They want to work 12 hours. They want to work 7 days a week or work 2-3 jobs or whatever. They like moving around, so they're constantly, uprooting their life and starting over or whatever the case may be. But those things only you could take care of. Life changes. It is stressful, like if you get married, even though that seems to be obviously a good thing, but your body doesn't know the difference. It doesn't know married from divorce. It just knows the stress. It's going to take the same type of toll. Irritants. Maybe there are things around you that are irritating you. Work can be very stressful. Maybe you don't like your coworker or you don't like your job. Maybe you're overwhelmed. Maybe you're underwhelmed at work. Every little bit plays a part. There are people who have a job where there's literally, my sister had a job where she had literally nothing to do. There was no assignments for her. So she was so stressed out because she's constantly every day thinking they're going to tell me, they don't need me anymore. And then she's had a job, that same job, where she was working at least 80 to 100 hours a week. And it was like she didn't even get to go home or see her kids or anything. She was just constantly, just too much. Either way, same effects on the body. Money's a huge stressor for people. If you have too little, even having too much money can be a problem for people. Then expectations change. You have money, you can help me, you can do this, you can do that. People have different expectations when you have so much money also. Relationships, I think that's a big one. If things aren't going right at home or with your child or your parent or your sister, your brother, it's going to affect you some way, shape, or form. So examples of stress, the death of a loved one. No one ever really, looks forward to that so much. It can really turn your whole life upside down. We'll talk about that. A divorce, that's a huge one. I heard that that's even worse than the death of a loved one because that person's still around and you still can contemplate possibly getting back together, possibly reconnecting. What could I have done different? And then you have to rearrange your whole life, your friends, everything. So that one really can turn your life upside down. Loss of a job, that's a huge one. Increase in financial obligation, or maybe your significant other lost their job, and now your money has to go that much further. Getting married, like I said, that definitely all the planning, the money, wanting things to be just so. moving into a new home. That does put a toll on people. They can uproot, they got to get their kids situated, and it's definitely change everything over. It's huge. And then not to mention what they're going to do with their old home. Chronic illness and injury, that's huge. I've had people where I've helped take care of them, and it's just like, they don't want to be a burden on their family. They don't want to admit that they need more help than they need. They want to be able to function like they used to. If you did something for 20 years and now you can't do it anymore, it's a habit. Not to be able to do it is even that much more. It's a big part on your self-esteem to not be able to do something because you got a chronic illness or injury. Emotional problems, depression, anxiety, anger, grief, guilt, and low self-esteem, all are different things that can definitely stress you. So causes of stress, like just elaborated on, the situation and pressure that causes stresses are known as stressors. We usually think of stressors as being negative, such as an exhausting work schedule or a rocky relationship. However, anything that puts a demand on you can be stressful. So I tell people, like, when they're extremely stressed out, and I've helped people a lot with this, where their adrenals are burned out, I'll tell them, clear your calendar. Just clear the next 30 days. We're not doing anything extra. We're not going to a PTA meeting. We're not doing one extra demand, because these people, most people who, when they get to the point of adrenal burnout, they got that personality that are like a type A, like they are involved in everything. Everything has to be just so, and you have to tell them, like, you have to take some downtime. Like, seriously, you're gonna burn yourself out. So if it's a good thing, it doesn't matter. We're not doing anything extra. There are times where you have to just really set some limits for yourself. Okay. So the effects on the actual body, your head, it can definitely change your mood, make you more angry, depressed, irritable, sad. Low energy is huge. Swings in your appetite. Sometimes people don't want to eat at all because they're too stressed. Like, I'm a person, like, if I'm stressed, I'm not going to eat anything. Other people are looking for comfort food, Concentration problems, sleeping issues. So maybe you can't sleep at all. You're up all night, or maybe you're just sleeping all the time. Headaches and pain. So, like, you can also end up with a panic attack, like, to the point that you're having heart palpitations, chest pain, everything else. Your skin, you can have acne breakouts. Have you ever talked to anybody and been in a heated discussion and they, like, end up with hives? That's a stress response from the adrenals. Your heart, you definitely can increase your blood pressure, increase your heartbeat, increase your cholesterol, and your risk for heart attack. I had a patient, she was just a normal girl. She didn't have a whole lot going on. Like, she was there for, like, just smoking little things, not, her son died, and at the funeral she cried so hard that she ended up having a heart attack, and she did pass away. But, like, literally, it's like, you can pass away from a broken heart from being too stressed. It was something like she just wasn't able to, she didn't everything she'd have to do, and I think I'd probably be in the same situation. How do you get through that? Stomach, cramps, reflux, nausea, weight fluctuations. Women really carry a lot of stress in their stomach. So, like, women will have more, like, diarrhea, constipation, acid, nausea, stomach cramps, and stuff like that. Pancreas, you could actually end up being a diabetic from being too stressed out. So those adrenal glands, which are the glands that sit on top of the kidneys and help keep us alive, they also regulate your blood pressure, your fight or flight, and they regulate how your sex hormones and also your blood sugar. So if your adrenals are constantly stressed, and you get burned out, you could actually spill over and become a diabetic. We talked about the intestinal problems, reproductive problems. I mean, like, for a woman, you might not ovulate that month because you're just so stressed out that the body just says, nah, this is not a good environment. It could also give you more painful menstrual cycles. It can decrease the man's sperm production. And then your immune system, it definitely can weaken your immune system. Like, usually when people are stressed, they're not eating like they need to, and they're not sleeping like they need to. And we need to eat and sleep to be balanced and whole. So when you don't do those things, then opportunistic things start to come up. You get a cold you can't get rid of. You catch everything that's going around. Okay, so the immune system, like, if we talk a little further about that, it's much easier for you to get sick and much harder for you to fight off bugs. So when people are stressed, they get sick. They literally, you ever heard of somebody being so stressed out they got a cold sore? That's a part of the immune system, like bringing that virus back out. If you're good, the virus is kept dormant in the dermatome. If you're not, it can come out. I had that, I forget what was going on, something crazy, and I was like literally like so stressed out thinking, I'm like, oh my God, I haven't had a cold sore since I was 7 years old. And I'm driving, and I got the biggest like 45-minute drive. It took me like 3 hours or something. And I'm like, oh my God, I'm gonna be late to work or whatever. And I got the biggest cold sore like that you could ever imagine in that little bit of time. I'm like, but I was so worried about getting where I needed to get. And it does. I think that we take it lightly because everybody goes through stress and stuff like that, but it really does take a toll on you. And so me stressing to get where I had to go wasn't going to get me there any sooner, instead of just being like, you know what, as long as I get there safe, your mindset is going to be the biggest thing to help you overcome it. Financial stress. Okay, so me, I know all about financial stress from being a kid. I grew up very, 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 very dirt poor. We had like nothing. So for me, it wasn't a big stress because we didn't have anything to lose. So actually it felt kind of good. We didn't have nothing to lose. And it was just like about family and connection and stuff like that. But it does take a toll on people. If you don't know how you're going to pay your mortgage or your rent or your car payment, or you don't even have a car to pay a payment on, or no resources, no backfall, you definitely will worry a whole lot more about, how you're going to be able to get to and take care of your family. And yeah, maybe you took out a loan, maybe you've already exhausted all your resources and there's no way of paying the stuff back, and also can't use those resources anymore. That's definitely something that will stress you out. So it can have major, same thing. It could cause heart attacks, strokes, panic attacks, everything. I had patients in the past where they're like, no food, so they're skipping meals and becoming like hypoglycemic, dizzy, everything, because they're just like, well, I'm only eating once a day to just try to stretch out my money. And it would definitely stress your body out, and then they're always sick also. Relationships. Okay, so this is a big one. Even happy relationships are a source of stress. Okay, so every good marriage or relationship has its bumps and problems. And even just being happy, being excited it's a stress to the body. So if you're cohabitating with someone, they have their upbringing, you got your upbringing, and trying to mix them together, and you have an expectation that, hey, in my family, my mom, my dad, they did this, they had these roles, and then they had theirs. Maybe they didn't have a dad, or maybe, whatever the case may be, and they're coming in with this mindset that I expected when we got together you were going to do. These things you never even talk about because you just didn't think you needed to. And then there are times where people want to have breathing space. Maybe one person's clingy, maybe one person needs like a lot of downtime from the other person. It's a lot of things that go into a relationship that can make things stressful. What I would say in a relationship to try to help with stress is communicating and not having unfair expectations on whoever it is you're with, because at the end of the day, they had their upbringing. You're not going to change it just because they met you. They were raised some kind of a way, you were raised some kind of way, and then being able to accept them for who they are. And maybe if they need that breathing space, my husband needs a lot of breathing space, and it's like, I'm a twin, I don't need any breathing space. I was with somebody the second of conception. What do you mean breathing? What are you talking about? It took me 20 years to be like, okay, well, I'll give you, like, how many minutes exactly, but it took years to not take it personally, but just try to keep in mind that everybody's individual, and you don't have to have the same mindset as them. You just have to come to the same conclusions. Bereavement. So this is understandable. This is a huge stress. We don't know who the person is. At this day and age, it could be anybody. It could be for any reason, the most horrific reason down to natural causes. So it can really take a toll on you, whether you expected it, when you lose a loved one, people go, well, did you know it was coming? Like, does it matter? Does it change if I knew it was coming? Like, no, I still don't like the outcome. And it's so permanent. So this can be one that can really stress you out. So my own personal experience, when my mom passed away, I was very, very, very sad for about 18 months, literally 18 months of just, like, I just didn't understand. I didn't understand. I mean, I went through so much grief for so, so long. If you're going through bereavement, I do recommend getting like grief counseling, whether you feel like you need it or not, because you'd be surprised because, you know, it waxes and it wanes. You have days where you're like, oh, this is a good day, but you'll have other times where it just hits you all of a sudden, and it's good to have other people to talk to who've been in your situation and can help you with coping and get through it. So, you know, these are unexpected things. Even if it is expected, always try to get some extra help for yourself, especially, you know, if it was something tragic. Don't try to just cope with it. Health worries. So, yeah, this is huge. You have fears over your own health and well-being, or that of a relative. That's huge cause of stress. I mean, you know, if your child is sick, or your mom, or your husband, or wife, or something, that's huge. When you don't have, especially for a man, because men like to have control over situations. They like to fix a situation. So when something's like not necessarily fixable, then it can become like the person can withdraw whatever their coping mechanisms are, and it's like, oh, you're giving up on me, you know. So you have to know about yourself, how you deal with illness and situations and things like that. I've had a lot of people who keep things secret up until the end because they know that it's going to stress out their family, and then they don't have any family support, you know. And then it's like, oh, it's not till the end that everybody finds out, oh, this person was sick, they had this, they had that, or whatever the case may be. And it's just a huge ball of stress. So when you are sick yourself, you do need a support system. You do need to involve your family or friends or whoever the case may be. And when you have somebody who's sick in your life, you do want to be sympathetic to them and try to help and try to be as supportive as you can, because I mean, it can be huge, and maybe it's just a small illness that you do overcome, but if it's something that's ongoing, like a chronic injury or illness, you want to make sure you have your support systems. Okay, so stress, you can end up with a cold or flu, cancer, depression, eczema, and other skin disorders. Post-traumatic stress, maybe something awful happened to you years and years ago that your mind keeps reliving, you know, and you're not healed from. Stomach ulcers. There are a lot of people who give themselves ulcers worrying with acid, and you know, and they might drink more alcohol, smoke more cigarettes even. Heart disease, that's huge. And asthma. You can definitely have asthma attacks from like getting unwanted news, or you know, just being in a stressful situation. So how do we manage our stress? Well, everybody's stress level is different. So for me, I feel like I could take a lot of stress. I don't do well with somebody dying, like a loved one dying. It's like, I don't do well with that one. But I can do well with just about any of the rest of them. But there are other people who do fine with death. They're like, oh, this was a good thing, honey. It was great, you know, it was a good death. She needed to go, whatever. And I'm like, oh, I've never had that mind. But some people think like that was actual stress relief for them. Maybe they have an elderly parent or loved one they've been taking care of for years, and it's actually a relief. And then there are other people who it's like, you know, they're stressed out and it seems like it's hardly anything going on. It's like, I'm taking one class, and it's like, wow, I took 5 classes, had 2 kids, was married and worked full time. You're taking one class? I mean, you know, but everybody has their own perception of what stresses them out. So I try not to judge. But you need to avoid stressful situations. So whatever a stressful situation for you is, okay, avoid extremes. So, I mean, there are some situations that are just absolutely extreme, absolutely going to be like a deal breaker and could literally emotionally take you down and under. Sometimes you just have to say, nope, not going. Maybe it's a family event. There's this family member who you know is going to be there. You know they're going to cause all kind of trouble and turmoil. And maybe just say, you know what, I'm just going to avoid that, skip over that whole thing. Set a realistic goal for yourself. So you don't need to stress yourself out trying to be like perfect in any one area, or like sometimes just overworking. A lot of times people, they don't look at work as stress, but it is. You got to get here, you have to fulfill an obligation, you got to work with people. So if you do that 12 hours a day, 7 days a week, maybe that's not realistic when you're stressed out, when you're already got enough going on. So maybe scale, back if you can. Manage how stress affects you. So it is how you respond is what's going to happen and what's going to make the difference. Like I said, my mother died. I had a nervous breakdown. My friend's mother died, and he was happy and laughing and just day and night. He maybe had one tear out of the whole time. Like, are you kidding me? Like, I was a little annoyed that he was handling it so well. Change how you see the situation. So I had a job where I worked, and it was just it was just like a nightmare. I would get there, and I'd be like in the car, like, I hate it here. As soon as I get there, I'd be crying, like, oh God, I don't want to be here, I just hate this job. And then I'd leave, and I'd cry, and I just said, okay, I have to change my mindset. I'm going to just start saying I love this job. It don't have to be true, but I'm going to start saying it. I love this job. And I wrote down a whole list of things that I loved about the job. Okay, great benefits. Okay, I like my hours. I do like some of my coworkers. I do like helping save people's lives. I do like my pay wage. I have made some lifelong friends. I would just focus on that. And then eventually I actually did really start loving the job. So always try to look for the silver lining in any situation, whether it be good, bad, or different. Look at the good. There's always some good. There's always some good. Even if you're in a black room and you have that little cell phone plugged in and that little dim little light, that's really bright in all that darkness. So you're going to look for whatever it is. Focus on that. Just stay there. Okay? So change how you see it. Set your priorities. So we're going to prioritize what matters the most to you, and then you're going to let go of some things. When you're stressed out, you do have to give up some things. You can't keep doing all the same things and expect a different reaction. Either you have to let go of how you're reacting to the thing, or you have to let go of things that are going to stress you out. Take control of the situation. Discover new relaxation techniques. And I used to always be told, breathe, just breathe. It's huge. Breathing is huge. If you can, and it don't even have to be literally breathing. It just pause. Don't let the situation overwhelm you. And I literally will start thinking about the trees, the birds, the grass, the sky, whatever. When if I start letting a situation just really those racing, flighting thoughts of oh my God, what about this? What about that? Like when my mom was sick, it was just what about this? What else can I try? I just can't even tell you how much I was thinking. And I had to go outside and be okay, this is bigger than me. I'm very small in the grand scheme of things. This is a very small thing, And I just had to look at the universe, the atmosphere. That's what I do. So you'll find things that help you relax, whether it be a song. Songs can definitely change your mood. They can change it to good. They can change it to really sad. All of a sudden. So find a mood-changing song that helps you be happy, helps you to relax, helps to take you to that good place, and listen to it. Take 3-4 minutes, listen to the song. Figure out what's most important. So the people who I've talked to who've been really completely stressed out to the point of adrenal fatigue, I say, okay, we got to work. Okay, fine, we got that. So we're not going to pick up any overtime. We're not going to, volunteer to do anything extra. We got to take care of our kids. We got to take care of our spouse. We're going to do just the essentials, so you have some time to sleep. A lot of the stuff is just self-inflicted. It's taking on too many tasks, trying to be everything to everyone. Sometimes you just can't. I used to always try to be everything to everyone. Now I'm hey. Definitely for you guys, I'll be everything you ever need me to be, and more. But my brothers and sisters, you got some people who are just clingy and they're users, and they will just suck all the energy out of you, and they'll take everything. They're called takers. Sometimes you have to cut some of the takers out of your life, and I had to do that. I had to do one at a time. Hey, you, nope, you're off the list. You, yep, no. It's just constant. You would not believe if you let people leech onto you and make their problems your problems. It becomes very stressful. My brother was just, I can't even tell you. My baby, my wife, it's like, listen, okay, I had to grow up. You're older than me. You got to figure this thing out. I gave you some good tips. Did you use any of them? I wrote it all down. I mean, I quarterbacked the play completely. Did you do any of it? No? Okay, well, can't help you. Don't talk to me about literally, I had to tell him. Because I was losing sleep, worrying about his marriage and everything else. I'm like, look, okay, all stuff that you're doing on your own. It's not like your marriage is broken because something different. It's all you. So if you're not going to make those changes, I don't care to even talk about it anymore. So figuring out what's most important is huge. And you know what? I feel much better having let go of a lot of things. I had a lot of guilt because, like I told you, the money thing, if you have too much or you have too little. So it's like I have too much for my family. It's like I'm a millionaire, even though I would love to see where the money tree is and the thing I have. I should go shake and get the money all the time. But you know what? They have an expectation out of me. It's like, hey, I need you to pay my rent. It's like, and I would used to do it. And I was like, no, nope, I have nothing. I've got nothing to help anybody with anything at this point. So, and I felt a lot better about it. At first I felt guilty. I felt like, gosh, I could do it. But you know what? They could do it too. And they're choosing not to. So I can't do for you what you won't do for you. Meditation. I love meditation. I could not do it at first because it's hard. It's hard to just take out time to clear your mind, especially like as a woman. Women are always thinking. Men, you ask them what they're thinking, they say nothing, and it's true. So,
Come on.
no, really. Men don't think as much as women. I gotta get a laugh or something out of you guys. At any rate, meditation though. If you get time, take out a little time for you, your me time, and do try to meditate. There's actual studies that show that people were on medication, other people were not on medication in a group, and they did meditated guided imagery, and their blood pressure was matching those of the people who were on medication. A lot of times, I think that we, in our society, is set up for just go. We weren't really built for that. We weren't really built for a lot of the things that we do. And we were supposed to have some downtime. We were supposed to have some quiet time. We weren't supposed to constantly be entertained, constantly with an electronic. So if you get time, whether it's a minute, 5 minutes, 10 minutes, whatever you could do. If you're having a lot of stress, just take, I'm taking 5 minutes. That's not going to change anything in your life. To take 5 minutes away for yourself and relax. And just let go and just do nothing, just for 5 minutes of just peace. There's a guided meditation YouTube video link if you guys are interested in that. So the goal of meditation is not to control your thoughts, but it's to stop letting them control you. That's huge. I love that. Because they can control you. They can control how you react, how you respond, what your next move is. Because, sometimes we get so many fears and so much negative self-talk. And like I tell people, if you have a lot of negative self-talk, then just set a timer on your phone and just say, again, 5 minutes. And then that's it. And then do 5 minutes of positive, the exact opposite of whatever it is. If you think, like, I'm so fat, then just start thinking, I'm thin, I'm skinny, I'm healthy. Start thinking some good thoughts towards yourself. You'd be very surprised. And there are people who get so far gone in negative thoughts they can't even think of any good thoughts. So, you do just the opposite. Whatever it is you said about yourself negatively, reverse it. And you'd be surprised how much better you feel about yourself and how much easier life will get for you if you start doing those thoughts. Like I did with the job situation. I actually started liking that job. I was like, yeah, I can do this. But I had to talk myself into it, and I had to retrain how I was thinking. Exercise, this is huge. Exercise, a lot of times people will be on depression medication or anxiety medication and start exercising, and they can tell me, I don't even need it anymore. It does make a big difference in your natural endorphins and neurotransmitters and stuff like that. So if you can, whether it be low intensity or high intensity, you do want to try to exercise. You could do yoga, you could do Tai Chi, you could do the elliptical walk, however, whatever you like, pick something. And if you got to start with 5 minutes a day, start with 5 minutes a day. But we'd be up to 10 minutes, which is not a deal breaker. for just de-stressing, decompressing, and then some exercise, something constructive. Social support. I think this is huge. Everybody needs someone that they can vent to talk to, confide in. If you do not have someone, I can be that someone for you. Just come see me. But friends, family is huge. You want to have an outlet to be able to kind of unload or talk through, or a sounding board for yourself. So try to make that time, that person, that connection. Everybody needs somebody. We weren't put here to be solo or to internalize and bottle up everything. Some things you keep to yourself, but like if it's something that's really bothering you, you should have someone you can confide in. I did put this in here. I don't know if it pertains to you guys, but like if you're having issues with housing, which is a huge stressor, then there's some housing resources in that for you here. And just more community financial resources. Assistance through the county for food, heating, energy. More low-income housing information. There's also what's called our employee assistance program. If like, so you don't want to talk to me about it and you wanted to talk to somebody like completely confidential, you get 3 free phone calls a year for any one problem. So let's say you're having a problem with your marriage, you can call and talk to them, a licensed counselor, and you'll get 3 visits for 1 hour. And then let's say you're having a problem also with financial issues, you can call about that and get 3 visits a year. Let's say it's just stress and anxiety, you can get another 3. Let's say you have alcohol or drug dependence, you can get another 3. So it's got to be 3 separate, like they're not going to be like your professional long-term marriage counselor, but they can help and direct you if you need it. And we have handouts in that in the front and cards for them. It's just another food pantries place. This is just about grief. So usually with grief, there's a cycle. We start off with like denial, like, oh my goodness. Now, grief doesn't only pertain to the loss of a loved one. It can be the loss of a relationship. It can be the loss of a job. It can be anything that you're grieving a loss of. So first you start off with denial. Then you go through anger, depression, bargaining, and then acceptance. So these are the cycles. Sometimes people get through this really, really quick. Sometimes people stay in one phase a lot longer than others. Like I stayed in the depression phase for like 18 months. And then I went to acceptance and there's no bargaining. Definitely do recommend grief counseling, like I said. So it doesn't have to only be for the loss of a loved one. If you've lost other things that are near and dear to you, you might want to consider grief counseling. And so that you could like identify the triggers that get you there and know how to cope. Here's some contacts for grief counseling. So, slow down, relax, enjoy life, go outside, take it easy. I always say don't sweat the small stuff and everything's small stuff. Like try not to make things the end of the world. Try to be easygoing. Try to treat people how you want them to treat you in a situation.